No, that's really important. And what you're doing right now is giving yourself community. But that's an important step towards health. So without further ado, I want to talk about Mr. Greenwood, Mr. Andre Greenwood. He's a very accomplished man. He's the market leader and interim CEO for Aetna Better Health of Georgia. So he leads a multi-billion-dollar healthcare organization. He focuses on government-sponsored healthcare programs, and he has over 20 years of experience in the healthcare industry. His focus is cultivating collaborative environments and advancing organizational goals. Now you can see why I invited him. Before his current work, he worked as the Chief Operating Officer for Aetna Better Health of Louisiana. While there, he directed the provider quality and operations teams, as well as community outreach and marketing. He's also served as the Vice President of Field Network Management at Centene. And prior to that, he was the Executive Director of Managed Care at Wellspring. He didn't have anything to do with AMC. Mr. Greenwood is very well educated. He went to an HBCU, Florida A&M University, right? Go HBCUs. He had an executive MBA from Georgia State. When he's not working, he enjoys travel, sports, media, spending time with his wife. Now, I know Andre because we serve on the executive board of the Center for Black Women's Wellness. So Andre is not only the CEO of a health organization, but he's a man of the community. So he talks the talk and he walks the walk. And it's an absolute pleasure to come and speak to our august audience today. So without further ado, Mr. Andre Greenwood.
No. Thank you. Thank you, Roma, for that. Thank you, Dr. Parker. When he was going through that bio, who was there? Who are you talking? No, Dr. Trumbull and I, we sit on the board of Center for Black Women's Wellness together. And we talk about a lot of different initiatives that we're going to need to achieve to make sure that we have a healthy community. And as he stated, I always come in our board meeting and I say, without a healthy community, we don't have a community at all. Throughout the bio, he discussed a lot of different titles and things that I do. But I want to start off in something I also say in different settings. If serving is beneath you, leadership is beyond you. If serving is beneath you, leadership is beyond you. When I graduated from the Florida A&M University, I'm an extremely proud Rattler, and met my wife at FAMU, and we've been married for 14 years and have two beautiful daughters. I think that's the highest title that I hold is being a husband and a father. But when I came out of undergrad, living right here in Atlanta, something drastic happened. Hurricane Katrina. And last night I just flew back from New Orleans. And I got this big executive leadership program with Humana. I was traveling all over the country, but I was coming home and seeing people that looked just like us dying on TV and not receiving the proper care. And at that moment, when you're a leader, you have to understand what your purpose is. And anytime when you're in these different meetings, they talk about what's your best characteristic. And I say, I'm a servant. And they'll look at you like, what do you mean? I said, I'm a servant leader. And so from that point, when Katrina happened, my job gave me the opportunity to work on the ground in New Orleans. So for 120 days, I lived in Emory, Louisiana. I traveled back and forth from the Superdome. And my number one job was to determine what prescription drug our members were taking. Because if you remember, they kept saying people were overdosing. They just didn't understand what prescription drug they were taking. And if I asked the average American to pronunciate or spell the drug that they take, that would be a very small percentage. So we're talking back in 2005, where there wasn't any My Chart or electric billing. All those medical records were just floating all throughout the metropolitan area of New Orleans. And it was at that pivotal point that I saw people look just like me, that I knew in my career, I was going to make sure that we focus on all people, as I have done in my career, but make sure that people that look like me is not forgotten. After that initiative, I came back to Atlanta and I said, we need to do something with a research center. So this topic earlier is right on point. How many people are from Atlanta, the city of Atlanta? Okay. If people remember, when there was housing projects in the city of Atlanta, there was one particular one in the Bankhead neighborhood called Bowen Homes. Bowen Homes is the only housing project in the entire state of Georgia that had a medical facility in it. At that point is when we did research on hypertension, diabetes, STI, and HIV. That was the first catalyst that we started in Metro Atlanta to make sure that we were focusing on what? Black males at that time, right here in Atlanta, and that was 2006. And so I'm kind of going through my journey of things that I have done working right here in the community, but my overall scope is all 159 counties here in Georgia. So I make sure that we have a rural initiative, which is outside of the Metro Atlanta counties and also inside the Metro Atlanta counties. As I stated before, I sit on the board for the Center for Black Women's Wellness. I'm chairman of the Andrew and Walter Young Family YMCA. I'm on the board of Grove Park, which is a section of Bankhead as well. And I'm also one of the first males to sit on the board of Girl Scouts of America. So again, I'm a girl dad, so I have to make sure that I understand. There you go, right? Because a lot of times we look at social media, you look at the news, and they kind of try to tell you who you are. But when I'm in a room like this, I already knew who we were. But it's also a great feeling to be reinforced. Because a lot of times I'm in corporate boardrooms and settings by myself. But as I look around this room, you all are with me because I'm standing on shoulders of giants, unsung heroes, you all in this room who make me do what I do. Because again, I understood my purpose of why I'm here. And so as we talk about different health disparities that we face in Atlanta, higher rate of chronic diseases such as diabetes, hypertension, cardiovascular diseases, I would be remiss if I look at some of the elderly population here in the state of Georgia. In some areas, we see HIV and STIs on the rise amongst all demographics. So when we look at certain diseases, it doesn't impact a certain age group. When we look at Black males, we're starting to see diseases that impact all Black males. We're starting to see chronic diseases come amongst young men, literally under the age of 18, being diagnosed with diabetes and hypertension based upon the behaviors that we see at home. We turn on the news, we see what is happening in the world. We know what it is to be a Black male, but what's happening right now in 2025, your mental health, some of us are barely holding on. And sometimes every day when we wake up, you have to look in the mirror. Are you okay? Literally, are you okay? And then sometimes you look at yourself, then you have to look at your neighbor or your son or your cousin or your brother. Is he okay? Because the day-to-day issues that we're dealing with today truly impact our mental health. We have some of the lowest life expectancies in the world. But we're talking about Black males in America. Because when you go to the Caribbean and you go to other parts of Africa, triple digits become common. They're wondering, how is someone dying at 65 of an ailment? 40 years old, 55. It's very uncommon in a lot of other majority Black countries and islands in this world that someone dies under the age of 85 from natural causes. No stress. And then obviously I work for Aetna, a health care company, but we understand that there are disparities in our neighborhoods. Whether you're driving down some portions of Memorial Drive, how many PCP offices or specialists do you see? You're driving down Campbellton Road, Cascade, Metropolitan, Cleveland Ave. It doesn't matter which area of the city that you're in. Certain areas and neighborhoods don't have the same level of access of care. But then you go and look at nutritious foods. How many Whole Foods are in some of those areas? Right? So, you know, I live in the Smyrna area, and there's plenty of grocery stores to choose from healthy eating. But I still go all the way down to the DeKalb Farmers Market early on a Saturday because, you know, and again, I'm originally from Brooklyn, New York, and I come from Jamaican immigrant parents. So I have a cultural different background. But again, in our neighborhoods, we don't have access. But the same way we have access to fatty foods and entertainment, the same level of a business acumen that we would expect in our neighborhoods is not given to us from education, health, and wellness. And so these are issues that we see every single day. Social determinants of health is a major area that I oversee as well. Obviously, we see the economic factors, the income inequality, the poverty that we see in some of our areas, and quite frankly, unemployment. Now, these issues were here 4 years ago, 8 years ago, 12 years ago, 18, you go down. But today, we don't even know what the unemployment rate is looking like. It's skyrocketing. It's not unemployment of the average person that you think shall be unemployed. There was a study the other day, 25% of Harvard graduates are unemployed. So some of the highest institutions that some people write about, because I went to HBCU and I feel like HBCUs are some of the greatest institutions in the world. That we see majority of our professionals graduate from. They don't talk about that often. Majority of people of color don't attend HBCUs, but majority of Black people and people of color in leadership and executive roles, physicians, lawyers, politicians, attended an HBCU. So as we are dealing with what we're dealing today, education, still in the city of Atlanta, APS are still below the national average of where we should be from an educational standpoint. And if you get on I-10 and just drive west, it doesn't improve much more either. So when you look at some of the lowest, the most impoverished, highest uneducated level, the sickest, the most unhealthiest areas of the country, where is it located? Right here in the South. So in the healthcare realm, it's like anywhere else. It's like car insurance is the analogy I like to use. Wherever there's more car accidents or car break-ins, your insurance quote is what? Normally higher. Well, healthcare, where we have the most admissions in the ER, death, and the lowest outcomes of quality care and unhealthiness, then what's going to happen to healthcare rates? So everyone in this room is thinking, man, he works for Aetna, he's on the healthcare side. I'm paying a lot of money on healthcare. But again, just as they do that insurance quote for you for that car based upon where you live, right? Like I'm from Brooklyn, New York. You see plenty of Florida tags and North Carolina tags. Why? Because they don't want to pay that higher insurance rate that New York is going to tax on you. But you live down south, and so you can't hide from where you live. So when we talk about the disparities in the neighborhoods that we live in, you're wondering why. The number one question, like my pockets, this is expensive. And then I have people in this room that's been thankful, that's been blessed enough to see retirement. And I'm still paying all this money. I thought Medicare was going to cover everything. Well, our chronic diseases and illnesses are not the masses in America chronic diseases and illnesses. They base it upon everyone. Because if you look at medical benefits in rates in California or the northwestern part of the country, they're lower. But again, healthier people, right? You see more juice bars, more vegetarians. There's a lot of portions of America where you wouldn't even see pork sold cooked. The South is one of the key areas that I notice when you go to a restaurant, they don't tell you the ingredients in the menu. So, something is pork based, right? But you have certain parts of America where your head will be severed if you had a pork based item on your menu and that you did not disclose that. So there's certain behaviors that we see in our environment that correlate to the outcomes that we see. And that goes to the cultural norms, right? Normally, we talked about Sunday dinner, and we know when we talk about Sunday dinner, right? It don't matter where you're from. But Sunday dinner can't be Monday for lunch. And we're all guilty of it. Right? Leftovers. But again, it's going to the inflation of food. Healthier food is what? More money. So the theme that we keep seeing here is the financial impact of our decisions. And it continues to plague us. Now, these are some common health issues that we see amongst ourselves. And we talked about that earlier. But the question I have for myself, being in my position, what am I doing? We make sure that we have dietary coaches for our members, Medicaid members, Medicare members, which sometimes have a lower outcome of quality care. Making sure that we have healthy grocery stores and pop-up shops in underserved areas. Also to make sure that we have pharmacies in those key areas. And then one other key piece as well, that's not medical, but it is medical, is the dental area of it. If you notice, when you drive home, notice how many dental offices you pass when you drive home, when you get off that exit. When you don't see pediatric dentists in your neighborhood, it's already telling you where that child is going to go. When you don't see a pediatrician in your area, when you don't have an urgent care in your area, it's already telling you what that potential outcome or the likely outcome is going to be in your neighborhood. And then we know that there's economic and racial barriers that we see. And we have Morehouse School of Medicine, right here in Metro Atlanta. But we still have a small deficit of Black physicians. I have 2 daughters, and we had to travel all the way across town to make sure that my wife, what she wanted was a Black female doctor to deliver our children. You would think that was something common to find right here in Atlanta, right? The Mecca, the home, right? It was difficult to find a Black female doctor just to deliver a child. And, they have TV shows, Married to Medicine, and some of these other things you see on the networks. But if you were a Black female and you try to get onto their panel right now, it's closed because it's at capacity. Because there are not enough diverse physicians in Atlanta. So we're talking about just little Fulton County, and even the metropolitan area. What do you think it is in the rest of the world? Extremely small percentage. And so when we go back and we talk about our children are coming out of APS or DeKalb County or Clayton County that lost their accreditation some years ago, we're not producing the next leaders of the free world. And so that's why I do what I do, because we work from an education standpoint. housing standpoint, food insecurity standpoint, because that's what a healthcare company is. That's what social determinants of health is. We're supposed to make sure that we have a healthy community. It's part of my responsibility. And then now what we're seeing, again, when I talked about unemployment, that correlates into uninsured, right? We thought we had that issue handled, about 12 years ago, but now we're noticing again that the uninsured rate is going to skyrocket again in this country. And then again, your PCP becomes the ER, whether you're going to Grady or some of these other hospitals. These are real issues that we're seeing. We're at home thinking right now, how am I going to be covered knowing you have a chronic illness that's being untreated? Knowing you have hypertension and not taking blood pressure medicine. You're in your late 30s, early 40s, and you don't want to take that test that as men we know that we have to take a little earlier than some of our brothers of other nationalities. I didn't want to take it. I'm 42, but I took it. Because again, I have kids and a wife to live for. But when you're worried about food on your table, shelter, how you're going to support yourself, support your family, what gets put on the back burner? Your health. And then you're depriving your health, and then your mental health is declining. You're in a tough spot. But the reality is everyone in this room knows somebody in that predicament right now. And you know even more people that can go in that direction if they don't handle what they need to handle. And so the importance of preventative care, your PCP. One thing I do with my friends, we joke around, we go to games and we hang out. I ask them, who's your PCP? And some of them, I don't need a PCP. I went to CVS Health and I got an STI and an HIV test and it all came back negative. No. But that's the mindset of, I'll be honest with you, a lot of us under the age of 50, if you don't think you have maybe 2 or 3 illnesses, you think you're fine. Literally, you think you're fine. And we're not taking the proper precautions that we need to take in getting a full physical, not just certain blood tests from a provider. And then a lot of times you notice you don't even actually see an MD. The average person of color in this country has never actually been assessed by an actual doctor. Could be a PA, a nursing assistant. Think about it. You get your physical. You're sitting there. They give you your blood pressure first. No, you do your height and weight, blood pressure. I'm walking you through this now. No doctor yet, right? Vitals look fine. Someone comes in your room, they check your neck and poking your stomach and make sure your ankles are not swollen. Are you feeling okay? Well, yeah, I'm feeling great. Okay, put your shirt back on, just make a left, make another left, and go ahead and draw your blood and urinate in the cup. And then if you have my chart on your phone, within the next 48 hours, they're going to give you a range and let you know if you're inside the range. Now, my wife has my access to my health, and so she's already, I don't even need to look because she's going to check. So she checks, okay, you're good, you're in the range, but you never saw an actual doctor. There's people in this room that have shaken actual doctors' hands, but you've never been serviced by an actual doctor before. Well, why is that? Because if you go to a federally quality, FQHC, I always forget what the acronym stands for. Health Center, there you go, thank you. Drew a blank. But when you have high utilization of members in the FQHC, and there's only maybe one physician in the entire practice, and you're seeing about 50 to 100 members a day, insured or uninsured, people in the community, that doctor doesn't have the ability to see everyone. And so, as you heard earlier, you want to be assessed by an actual medical doctor because they're trained to see what different illnesses that could be persisting in that particular patient. But if you're not being seen by an actual doctor, it's too late. That illness that could have been prevented, and there's a lot of preventable illnesses that we all face in our communities, but it's not caught early enough. And studies have shown, because we do take surveys from our members, did you see an actual doctor? Well, they had a white coat on. They had scrubs, and I like the New Balances they had on with the scrubs. But you didn't actually see the doctor. And the way that I know I go behind it is because the physician signs the claim and said, I did oversight of this actual service. So when you look at a claim and we have claim professionals on the healthcare side, I could tell if you were actually seen by a doctor or not. And I can see some of the doctors nodding over here to my left, Dr. Parker, because they know what I'm talking about, because in the billing aspect of it, that's the documentation that we go by to create our forecast and how we need to care for our members. But sometimes the documentation is not clear inside of the claim. Because sometimes you hear about doctors, handwriting, and I'm pretty sure these doctors have great handwriting, but you can't really see all the notes. And then sometimes they have a medical professional typing in those notes, and they get it right maybe sometimes, but not all the time. But would you want someone to get that documentation wrong on you? And so there is a level of accountability that we have to take, because they mail you that claim back to your house, but you're just making sure what? Oh, I don't owe any money. Right? So if it's inside the copay and I don't have to pay much back, I'm okay. But if you look through that claim document, you have to see what they actually wrote, why they're giving you this prescription drug. Not just looking at maybe a code book and saying, oh yeah, this is normal. He fits in the range. African American, lives in this neighborhood at this age. They're given a hypothesis of what they think is wrong with you, rather than saying, you know what, let's do an EKG on him. What's your family history? But in our community, a lot of us don't fully know. In Medicaid, sometimes you're given your stepdad's information, but he's not your biological father. In my career, I've seen and been over foster care children who don't know who their mother and father is. So foster care kids are being guided all the way up until 18. But then when you become an adult, you're in that room by yourself, not knowing your history of who you are. But there's a lot of us who only maybe know one side of a parent's medical history, if that mother or that father knows the history of their parents. So a lot of times it's just a black box that we're walking into when we're getting our health assessed. And so what I'm saying is, you want that doctor to check for everything, unless you know you have a living mother and father. And what did I talk about earlier about Katrina? That was 2005 that medical records were floating in that water. Unless you have a living parent, and luckily I do, who have their electronic on their phone, they have their health history on an iPhone or a tablet. If you don't have a parent that has that, challenge your medical professional. Because I guarantee your parents didn't have a full health scan of themselves. So how are you able to tell a physician your medical history and your family medical history? Let's think about that. Your parents probably didn't even know their full medical history. So how can you tell a provider when most or some in the room didn't even actually see a doctor what your history is? So the person sitting across from you, taking your blood or your blood pressure, is trying to diagnose you from looking at you, or maybe some blood tests that you're going through, where there could be plenty of different underlying issues that could be occurring with you. Now, this picture that I put up here, I had some different pictures, but this is something I'm really proud of that I participate in every Monday night with attorney Malawi Davis. It's something called the Black Men Lab. Not sure if anyone's heard about it, but we do it on Campbellton Road every single Monday night from 6:30 to 8:30, where it's a room full of Black men only. Black boys, teenagers, elderly, middle-aged, but it's all Black men where we talk about issues that impact us every single Monday. It's a safe space because a lot of times we don't have that opportunity just to talk about things that are issues with ourselves. And sometimes you don't want to talk about it with a family member. But it gives you that safe space because what I truly believe is you have to give people access. Now, it's up to you if you want to take that opportunity to ask for help or guidance. But a lot of times we feel that there's no access that's out there, and we provide that. And being chairman, I have the ability to open up the doors and provide it as well. So again, we talk about healthy eating. You need to make sure weight management, you go through that when you meet with your PCP. One thing I love from the YouTube videos that I've seen here is you guys have an exercise piece and portion with the health and wellness, which is truly important. But as I close here and different things that I've done, I really want you to take time to take care of yourself. Because if you think about your life and outside of your parents or some of your close loved ones, no one's going to care for you more than you. And if you don't show up healthy, mentally and spiritually and physically, you're not showing up at all. And so I really challenge all of us to do that. And you all don't know, I have a grueling job, titles, and it forced me to do a lot of different things, but it's high stress. And so standing before you all today, that puts a battery in my back. Because after this, I got to go to meetings that are going to be thank you. Because I'm going to go into meetings where it's not necessarily family. And 95% of my day, I'm not around any family until I go home. And so you don't know how much power you all hold in what you do. This busy corridor that you got off on 85 is one of the busiest intersections in the whole city. But you guys came here and showed up. And that means something. So in closing, I just want to say thank you for this opportunity. Something I heard this week, never dim your light. It's time to put some shades on. Thank you.
All right, at this time, you may ask questions for Mr. Greenwood.
Test. Okay.
Morning.
Morning.
Who has access to my chart other than your healthcare team?
Yeah, so my chart, great question. So my chart is, there's a system called EPIC, and we're in Emory right now. So Emory, Wellstar, Piedmont, Northside, Grady, mostly Mount Sinai, every big health system, hospital system across this country has access to my chart. And EPIC is the system that all the hospital systems talk to. It's almost like your driving record. If you got in an accident here in Georgia, they'll know about it in Washington State if you try to get a license. It's the same thing in the medical world. So the minute that you're in my chart, that's why I was saying your parents their information wouldn't be out there. But if you have a parent that has a My Chart, then they do know the health background of a person. So if you're in My Chart, all your outcomes is in there. And any of these physicians could pull it if they're servicing you. Yeah. Oh, I know. Okay, I know where he's going with the question. Great question. So obviously, your healthcare provider, your health, which would be, it could be Aetna, United, any of those healthcare organizations, they will know, they will have access to your outcomes and your health records, because they're actually paying for the services that's being rendered to you from a provider. And then also, I think also where he's going with the question, I don't fully know, but people that are overseeing the federal, because if you're on Medicaid, if you're on any healthcare insurance company, there are federal dollars that are included with it. And so if someone has access at the highest realm of the country, I didn't say it, but you know, right, they could have access as well. So basically anyone that's running the federal government or the country could have potential access to your outcomes and your medical records. Yeah, I think where we're going, if they give state access, yes, state could have access as well.
Thank you, Doctor. I've got 3 questions for you. And the first one I wanted you to speak on was the mercury that at one time the dental profession was putting in our mouths. They changed the name, some call it amalgams. But when mine was taken out, the doctor came into the room with an hazmat suit. I wanted to laugh at first, and then I realized how serious this was.
Right.
And when I asked the VA about the correlation between dementia and mercury in our mouths, crickets.
Yeah, no, great question. So obviously with the VA is slightly different, but it should not be different. And I say that because they have more of a narrow network. When I say a narrow network, they can only see a certain amount of physicians that are inside the VA that handle VA members. But VA members are humans, they should have access to any physician or any provider, because sometimes when you go to diverse providers, you'll hear diverse outcomes. Every provider will diagnose you slightly different, depending on what the illness could be. But I will take, from the mercury standpoint, from our standpoint, we look into that and we would not reimburse and pay for that. And so most providers, all providers, they're not going to get reimbursed. They're not going to use that particular medicine or that procedure on a patient.
No, you didn't answer the question. The question is, do you know of a correlation between mercury in the brain and Alzheimer's disease?
No, I personally do not.
Okay.
Mercury is a toxin. It is a poison, right? The emperor of China, the first emperor of China, wanted to live forever, and he drank a concoction that had mercury in it. Well, he lived forever because his memory is still with us, okay? So, is there a direct relationship between mercury as a toxic metal itself? That I can't say, but I do know that environmental poisons and toxins have been shown to correlate with Alzheimer's disease and other causes of dementia. Now, that being the case, 50, 60 years ago, whenever, dental practice has changed, some things that were done in that time are not necessarily done now because the science has advanced, and we know that it's not healthy.
Yeah, the reason I bring that up is because there's several veterans in this room, and if the VA is silent about the correlation between mercury in the brain, then they don't focus on giving us a disability rating as our capabilities decrease. But I'm putting that out there for the veterans to pursue that on their own. The next question or observation. I'm 71 years of age, and I smoke weed, drink a lot of liquor, Cialis and Viagra is my best friend, and I'm partying and having the time of my life.
I love the honesty, and it's real. And let me tell you, that could be from 18 up. Okay.
But I find that there are four things that help me tremendously when it comes to memory. At times, if I have a memory fog, fresh rosemary tea will bring back my memory to an incredible presence. And then there's a couple other things, ginkgo biloba, bacopa, and lion's mane mushroom in capsule form, those things. Yeah, the last question is...
Sir, we're going to have to allow some other folks to ask questions as well.
But I need to get this one out just for the group. You spoke about the tests, and I know there are a lot of expensive tests that are reserved for the rich and those that, deep pockets. But can you elaborate on some of those tests that we need to ask for?
Before he answers that question, gentlemen, one question. I don't want to be the question bouncer, but y'all know I will. All right. Let's have respect and decorum for the room.
Yeah, no, thank you for that. So there is something called like an executive physical where cardiac stress tests, it's almost something that you really go through when you look for life insurance. When you're trying to pull that life insurance, they'll tell you to sit up and down 50 times in that chair, then give you, a blood pressure test, EKGs, pull up your heart. So there are, if you go and Google executive physicals and you look at what they look for in $1 million plus life insurance, it'll show you all the different tests that those insurance companies want and offer. How you doing, sir?
Thanks for taking my question. First of all, thanks for being here.
Thank you.
It's my first time. But you brought up something in your presentation, and this is involved the healthcare system. I happen to be an Aetna member, and I left a system, the Grady system, because I had a medical provider, doctor, MD, as my primary care, but to get an appointment, it was like, and then they would cancel the appointment. So I recently left in October, and I went to Oak Street Health. Now I have a nurse practitioner primarily, but the moment I entered there, I was given all of these different tests and batteries of tests that I never had at Grady. And so my question is to you, and Aetna suggested that we check out some of these senior places, and I tell you it's been a different, but so how do we, they're getting one at the place I'm at, they bring in on a medical doctor, but how do we determine or acquiesce to them to say, I need to see a MD?
Right. No, great question. So a lot of people don't know this. Aetna is actually owned by CVS Health, and CVS Health owns Oak Street. So to your question, who knows my medical outcomes? They know. And so that's why you were given that type of provider to do all the extra tests. And then I will say this, I know we're in Emory right now, but every provider gets different levels of care. Nothing wrong with Grady, because Grady has great outcomes and most people walk out alive. Okay? You walk out alive. Now, I don't know about the aesthetics and the bedding and all that, but you walk out alive. But when you're not in an emergent state, you want to go to a provider that cares more for you for the illnesses that you're looking for. But Emory is obviously the county hospital, but more of an emergent situation. And so I'm glad that you're getting that level of care.
We have one question over here, and we're going to jump back over to Doc.
How you doing? Thank you. The gathering you talked about on Camilton Road, exactly on Camilton Road is it? And do you have a website?
Yes, it's Black Men Lab. You can look at it on Instagram or on Facebook, and it's at the Andrew Walter Young YMCA. Oh, it just moved right down the street. I'm sorry. Is it 11? It's close to the mosque on Camilton Road. Yeah.
We can figure out the
we'll figure out that
exact
address.
We'll get it by the end. Doc, you have a question over there?
Good after morning still. My question is this, we as Black folks can take the most dangerous thing and we can glamorize them, such as cigar smoking. Got cigar bars everywhere.
Yeah,
And
hookah lounge.
Hookah lounge, all those things. So we were just talking about this the other night on a fraternity call. What can, I guess, you in the healthcare industry do to make sure that we put these things out, publicize them, tell them so that we won't be showing them propping up everywhere. Even the women now are smoking cigars. So can you just address that?
No, great. If you remember, the mayor of South Fulton denied new business licenses for unhealthy foods and entertainment establishments, all on Old National and all in South Fulton. And so it's going to really take local government, but it's also going to take us to go to those county city meetings to really push that certain businesses are not acceptable in our neighborhood. Because just like CVS Health sells no tobacco products at all, no vapes, none of that. But then what do you see? CBD shops are in every gas station. Where? Every single one. And what's next to it? A wing and fish spot. And then a barber shop. Literally. We all laugh because it's true.
That fish be good, Doc. I ain't gonna hold you.
Only on Fridays. Only on. I'll be honest with you. Growing up, fish spots were only open on the weekend. I thought we only ate fish on Friday and Saturday, but they eat it every day.
Along that line, I had a lot of interesting questions I wrote down as a result of your talking to us this morning. How do we overcome Blackness? And that's rhetorical. Mm-hmm. How do we overcome our culture, our eating habits? You talk about good food, but if I'm a teacher, ex-teacher, worked in the cafeteria sometimes with the kids, you could put good food on the table and they'll say it's poison. And I say, it's not poison, eat one green bean. And they'll put it in their mouth and they'll gag on it and almost throw up. And I say, don't do it anymore. Say, I told you it was poison. Mm-hmm. And they've been conditioned to that. And the people serving the food in the cafeteria, they don't eat it. You eat broccoli, Mr. Turnbull? Yeah, baby. I don't eat it. So how do we overcome Blackness? Rhetorical. When we go to the doctors, you mentioned having to see a doctor. In defense of doctors in the healthcare, it's getting overcrowded. And the doctors are in great demand. I just lost a doctor. He said he had over 1,000 patients in a week to see and address. Having said that, I got my chart and I read all, they got, you can't figure out anything until you answer all of the range of stuff. Mm-hmm. You said falling into the range. Well, if you ain't reading the range, then you're doing a disservice to yourself. Right. If you're not paying attention to it. So you need to pay attention to that. It's not a question. I'm making a testimony. and let's pretend it's a question. So having said that,
we're going to reserve this for questions only.
If you tell the PA, physician assistant, what's wrong with you, if you tell the doctor don't know anything until you tell them. And then when they tell them, those tests will tell you and will tell the doctor what's wrong. Right. So if you ain't taking a blood test or your analysis test, you're nobody gonna shake your hand and see who you are and what your ailments are. You take your car in, you gotta tell, hey, my car has this, that, and the other. You do the same thing with your body. This is what's wrong with me. And if you ain't addressing it, you need to be talking about it.
Right, no, thank you for that. First part, the question was, what can we change? We gotta change our habits and our behaviors. It starts at home. A lot of times we deal with the youth, but what we do is we get the parents, because as a teacher, you have that kid for maybe 6 hours a day. Then that kid goes back to his or her environment at home. And that's where we got to get in with the guardians of these kids to change their behavior.
So one thing, just to piggyback on that, one thing that I've realized with my two little kids and being an ex-teacher of culinary arts is when kids are very little, we treat ice cream, we treat cookies, we treat cakes as a reward system. Mm-hmm. So if that is the reward system and it's tied to positive moments in their life, when you offer them either ice cream or a string bean, what do you think they're going to choose, right?
Every
So
time.
what you said is spot on, right? We have to educate not just ourselves, but we educate our kids and our parents. But it goes back to the reward system. I have two little daughters, and when they do something good, you know what we do for reward? We spend 45 minutes in the garden. We pick our own vegetables, we dig, stuff like that. So education is key, and it starts with our kids. We're gonna jump over here. How many do we have left?
How many questions left? We have one here. I see more popping up.
I have 6
Right.
over here, so.
Oh my. All right, okay, so we have a lot of questions. One question, and it must be a question.
It must be a question.
Okay.
I'm not even letting them hold the mic anymore. I'm just,
All right, so
you standing up? Come on, stand up and just talk.
Jarvis. So the Black Man Sim Lab, the address is 2800
Okay.
Camilton Road. 2800 Camilton Road, Atlanta, Georgia, 30311. Now, before this next question, Andre, I would like for you, before you leave, to let these gentlemen know how current things may impact their access to healthcare and the healthcare provider workforce. All right. So,
Dr. Well, let me just say this. Let me just say this now. So you're hearing about potential cuts to the federal portion of this country. What you don't realize is Medicaid and Medicare is really in all the coverage that we have. And so if you go into a senior citizen home and you get an ailment, even though you're on Medicare, Medicaid is going to pick up that other portion, supposed to pick up the other portion. But if those rates are cut and then Medicaid is cut, you might not be eligible for that additional financial service that could be rendered to you as of today. And so we are at risk financially for those coverages. And if you can't make the payment, then that bed or that room would not be available. And so there are things that are going on that can obviously impact us from a health standpoint. And then obviously the financial rates can continue to go up. And then what they're doing is they're changing the requirements on what it is to be on Medicaid. And Medicaid are mostly moms and babies. So right here in Georgia, we cut hundreds of thousands of children off of Medicaid. And those are children that are not insured and don't have the behaviors at home to live a healthy life. And so the outcome is going to be rough for those children to have a healthy life as an adult.
Mr. Greenwood, thank you for coming.
Thank you.
My question is there any publication of a network of minority medical professionals that we as a minority can access? Because I know we're different, and so we need to go to a medical professional who knows what we're made of.
Right, no, great question, Dr. Trump. I know Dr. Frank Jones, he was, there is a Black physician network in Metro Atlanta, and they have a network full of Black doctors, different specialists, right, Dr. Trammell?
that's correct. It's called Find a Black Doctor. It should be a website. Just look it up. Find a Black Doctor.
Right. And it's a large, it's a very large network that touches all the Metro Atlanta counties.
So this is the last question.
Yeah, last question over here is, we have 5 more minutes left. This gentleman wants to know, can you briefly describe the difference between a physical and a full healthcare test?
So physicals normally, you know, I forgot how many blood tests, Dr. Parker, maybe someone has to help me, but it's just an overall kind of holistic test of you, you know, checking A1C, glucose, cholesterol, those type of things. They do a physical exam, check your eyes, your ears, your joints. And then a full assessment would be more literally from head to toe. And I've actually had one, you get scans, CT, x-rays, MRIs, EKG. You're literally checking everything that could be an ailment for you. And it's way more, you go to a GI doctor, way more of a different type of test. And also I've done mental screening as well.
Wait, it's the question, what is a physical examination?
Versus a full.
Well, all right, so physical, that's just checking your body.
Right.
Okay? Listen to your heart, lungs, look at your eyes. other things, as you get older, and make sure you can go to the bathroom without any issues, right? You said a full medical. Say what now? Full healthcare test?
Yeah.
Okay, so full healthcare test. So look, the physical, again, that's just an examination of the body. I think what you're trying to ask about the full workup or the full healthcare test, that's going to include, as Mr. Green was alluding to, labs, imaging, things that can confirm physical findings, things that can confirm a provider's suspicion of what may be wrong with your health or right with your health.
And another one last thing on that is sometimes you have to pay more money out of pocket to get that because the physical exam is included in every health benefit in the country, but those additional tests will cost more dollars out of your pocket to receive. It's not something that's normally included, it's something outside of the norm.
Mr. Greenwood, thank you. This has
Thank
been
you.
wonderful.